Hello everyone. Today I'm going to talk about signs and symptoms of heart failure. Normally, the right side of the heart receives deoxygenated blood from the body and then it pumps this blood into the lungs through pulmonary artery. In the lungs, the blood gets oxygenated and the lungs then send this oxygenated blood through the pulmonary veins into the left side of the heart. And from the left side of the heart, the oxygenated blood is pumped out into the body through aorta so that the body can use that blood. So if you have congestive heart failure, one or both of the heart's chambers lose their ability to pump blood, right? So if it is the right side of the heart that is not working effectively, then this blood, which is unable to pump into the lungs, will back up into the body, particularly in the legs, ankle and feet. In left heart failure, blood can back up into the veins that take blood through the lungs. So as the pressure in these blood vessels increases, fluid is pushed up into the lungs, which is called pulmonary edema. Now we know that in left heart failure, there is fluid built up in the lungs. So the patients will complain of dyspnea, that is breathlessness worsened by exertion. They will complain of cough, which could be dry, or they may produce a frothy pink sputum. Orthopnea, which is the sensation of shortness of breath when lying down. This happens because on lying down, the fluid, it settles across a large surface of the lung. So the patient will not be able to breathe as effectively. You should ask the patient how many pillows they use at night. Next is paroxysmal nocturnal dyspnea, or PND. It is a term used to describe the experience that patients have of suddenly waking at night with a severe attack of shortness of breath and cough. Patients will describe waking up and feeling acutely short of breath with a cough and wheeze. They will have to sit on the side of the bed or walk around the room and gasp for breath. They feel like they're suffocating. The reason for this is actually similar to orthopnea, as we mentioned, that the fluid, it settles down across a large surface area of their lungs as they're sleeping, lying flat. So when they stand up, this fluid, it sinks down to the lung bases, making the upper lungs clear and can be used more effectively. That's why they feel better when they sit up and stand. People with heart failure may find that they often feel cold in their arms, hands, feet and legs, which is the extremities. This happens because the body is circulating most of the available blood to the brain and other vital organs to compensate for the failing heart's inability to pump enough blood to the entire body. As a result, the extremities, they get less blood, and without blood to warm them, these parts of your body feel cold. In advanced heart failure, when the body can no longer compensate adequately for the failing heart, blood circulation to the brain will start to drop. Without enough blood, the brain does not function well, resulting in lightheadedness and or mental confusion. Let's go quickly through some signs of heart failure. The point of maximum impulse, known as PMI, is the location at which the cardiac impulse can be best palpated on the chest wall. Okay, normally it is at the mid-clavicular point in the fifth intercostal space, basically where the apex of the heart is. Now in chronic heart failure, the heart tends to become enlarged, known as cardiomegaly. Due to this, the PMI will be displaced laterally. On auscultation of the heart in left heart failure, other than the normal S1 and S2 heart sounds, we can hear S3 and S4, also known as gallop rhythm. We are not going to go into details of these heart sounds. We'll discuss about them in another lecture. Also, the P2 which is heard at the closure of the pulmonary valves, is louder on auscultation. That is because left heart failure causes increase in the pressure of pulmonary vessels as well. Also, if you auscultate the chest of the patient with heart failure, you'll hear crackles at the lung bases due to the fluid in lungs. Normally, the percussion of the chest will produce a hollow or resonant sound because there should be air in the lungs. But if the sound is dull, that indicates that there is fluid, such as pleural effusion or pulmonary edema. As we said, that in right heart failure, there is backup of fluid into the body. So patients with right heart failure will present with peripheral pitting edema, which means that there will be a visible swelling in their lower limbs, which is the edema. And it is called pitting edema because when we apply pressure to it, you can see an indentation, which indicates the presence of fluid in the lower limbs. Patients with right heart failure also complain of nocturia, which is increased frequency in urination at night. This is because when they're lying down, then gravity causes this fluid that is accumulated in the legs to move up into the bloodstream, where it can be taken up by the kidneys and eliminated as urine. In right heart failure, if you ask the patient to turn their head to the right and you look at the jugular vein, it will be distended. This is a very predominant sign of right heart failure. There is a reflex called hepatojugular reflex. What happens is that if you put a firm pressure over the liver of the patient, the neck veins will be distended. Also, hepatomegaly is another sign of heart failure. Not just the legs of the patient are swollen due to the edema. In fact, all the organs are congested due to fluid built up. So the liver will also be congested, leading to a bigger size of the liver. Similarly, there can be fluid built up in the peritoneal sac, which is called ascites. So you will find that the abdomen of the patient is also distended. In the presence of a heave, the heel of your hand is lifted off the patient's chest wall with each systole. This indicates a right ventricular enlargement due to right heart failure. Remember that a patient can have an isolated right heart failure or an isolated left heart failure or a combination of both left and right heart failure. Therefore, you can find all these signs and symptoms in one patient together. That's it for today. If you liked the video, then don't forget to press the like button, share it with your friends, and do subscribe to my YouTube channel. Take care. God bless you all.